If you look at the deaths here in Kern County, there is no mistakes. It is just lazy, outright just non-caring, and negligent.
Doctors are not immune from not knowing their job.
I had to deal with my child thinking that I didn't love her because of everything they did to her.
We are human taking care of human, and human can err.
The system failed her.
Choosing a healthcare provider or facility is a big decision for many because they hold your lives in their hands. Tonight, we introduce you to 4 people here in Kern County. Their families say the treatment they received at local healthcare facilities led to other health issues and in some cases even death. We also speak with 2 doctors who say while the medical industry is difficult to navigate, there are ongoing conversations to increase patient safety. And if you're unsure about a doctor or a medical facility, there are resources available to you. This is Do No Harm, Loss and Liability in the Medical Field. Tracy Dominguez still feels the void of her daughter, Demi Dominguez, who was 23 years old and about to graduate from college. She was pregnant with her first child when they both died. Her mother tells me she believes her daughter's death was preventable if medical professionals would have taken her symptoms seriously.
The system failed her.
It was April 19th, 2021, when Tracy Dominguez's life changed forever. That day is when her daughter, Demi Dominguez, who was 8 months pregnant, died. Shortly after that, the family experienced another loss.
We lost her, and 18 hours later, we lost Malachi.
Through tears, Tracy tells me the pain Demi was experiencing during her 3rd trimester on April 15th, days before her death.
Demi started having symptoms. She was swollen, and she didn't feel good.
When she couldn't see her regular OBGYN at the time, Demi still went to get checked.
She advocated for herself, and we did as a family, and we decided let's go to the local hospital, and, she's not feeling well. But that's what you do. You go to the hospital when you're not feeling well.
But Dominguez says help for her daughter turned into tragedy.
It just escalated into a cascade of errors.
She says when they were checking in at the hospital on April 15th, Demi was explaining her symptoms and they were ignored.
There was a man in the back with scrubs at the time. We don't even know who he was, but he asked her, what did you eat? And that's when she proceeded to say she had, ate Mexican food. And that's when he proceeded to say, well, you're swollen because you ate Mexican food.
Dominguez says the doctor's response shocked her.
He body shamed her. She kind of didn't know how to react to that, and neither did we. So then she went into the next room, and that's when, they put her on the monitor and her blood pressure was high. So they said they were going to monitor her.
But Dominguez says they didn't watch her. Instead, they gave Demi medication and stated she would stay in the hospital for 24 hours, only to be released early. California Department of Public Health documents found the physician notes from April 15th showed her medical record contained no formal diagnosis.
In the morning, I'm here, and she's walking through the door. And I'm saying, well, what are you supposed to be here? I'm supposed to pick you up at 2. Well, the nurse gave me the prescription, told me to pick it up and go home and bed rest and call my doctor in 2 days.
Demi did see her OBGYN doctor 2 days later, but according to her mother,
never examined her, asked her absolutely no questions about anything, and said, bed rest. And then he kind of just rushed her out and, oh yeah, Dad, give her a massage. Yeah, but she, and come back, in your next appointment.
That night, Demi had a seizure at home and was unresponsive. She was then taken to the hospital where she and her son later died.
When they come out and tell you that your daughter didn't make it or that they pronounce her dead, I literally just fell to the floor.
Dominguez says because of the shock of Demi's death, she never got to meet her grandson Malachi, who died a few hours after Demi.
I was just out of it. She had, there was a lot of people there, her friends, and everybody was screaming and crying. And I, to this day, I didn't get to go see Malachi because I was not in the right place and my mind, and I was hysterical.
Due to the California Confidentiality of Medical Information Act and HIPAA laws, there are no names on public medical records. But based on what Dominguez says, the documents that match Demi's case from the California Department of Public Health found, quote, the facility failed to follow its policy and procedure for assessments related to hypertension and preeclampsia. They also state, quote, Based on interview and record interview, the facility failed to protect patient rights for one of one sampled patients when physician 1 did not perform a physical examination or speak directly to patient 1 regarding her diagnosis, treatment, prognosis, plan of care, or follow-up. This failure had the potential to result in lack of information on patient 1's healthcare status and provision of inappropriate treatment. Her mother maintains when she was there, she did not feel like her daughter had proper care.
It's true that she never was seen by a doctor, never had a proper diagnosis, never once was the protocol followed for preeclampsia by the hospital, never urine intake, never checked to see if she had edema. Nothing was done. Absolutely nothing was done. And that's why she lost her life.
Dominguez says now her family is navigating their pain by taking action.
Trying to educate the nurses too, and the hospital and the doctors to take women of color serious, their symptoms seriously. I mean, she had every classic symptom, but nobody listened.
Through her advocacy and speaking at events about patient safety, she's learned she's not alone and believes it speaks to a bigger problem across Kern County.
And we do not have the best doctors. They don't really care here. That's why I feel like we have such high rates of all these medical negligence and fines, because they're not doing their job. And they just don't care.
And when it came time for Demi's sister to have a baby, they drove 2 hours to Santa Barbara for every doctor's appointment and her delivery to try and ensure she got the best possible care. While Demi's sister was able to safely deliver her baby, Dominguez says seeking care elsewhere shouldn't be necessary and wants patients to know how to support themselves.
We have rights, but we don't know our rights because we just don't know. We just trust the doctor and the hospitals and the nurses. And I just want to tell the nurses, listen to your patients too, follow the protocol. Follow the rules. You will save a life.
But she says Demi's death still feels like it was just yesterday, and they're still learning how to move forward.
As far as we're still trying to figure how to do this and how to go on.
Dominguez has also spent the last 2 years helping bring to life the Latina Maternal Health Fair to help educate mothers of color about how to make their own health care choices and speak up for themselves. Demi's family has also filed a wrongful death lawsuit against the local OBGYNs according to court documents. The jury trial is expected to begin May 13th, 2024. There are a number of resources available to you to research your local hospital, including the California Department of Public Health CalHealth Find database. Here's how you use it. You can search the area like Bakersfield or Kern County. You can even put the zip code in, which we did here, and all the hospitals will show up. Once you click on it, you can find more details and you'll learn more about the complaints and reported incidents, survey deficiencies, as well as enforcement actions over the last 4 years. If you want to learn more about this resource, we have the information on our website, turn23.com. About 1 year after Demi's death, Sabrina De La Rosa, a mother of 3 expecting her 4th child, also died. January 10, 2020, her mom says she went to the hospital healthy and 9 months pregnant, and while her baby boy is still here, she is not.
It was a shock to all of us that such a happy, joyous occasion turned into such a tragedy.
When Sabrina De La Rosa was 9 months pregnant, her mom says her daughter went to the hospital when she started having contractions and unbearable pain. Originally, she was checked in and sent back home, but when the pain continued later that day, she returned to the hospital.
She was, like I said, healthy and her pregnancy was, well charted, and there was no complications or anything, and she did not walk out of the hospital. She died due to medical negligence.
De La Rosa requested we do not reveal the details of this case because there is still pending litigation. But a search for the physician on the medical board says, quote, an accusation has been filed. The physician has not had a hearing or been found guilty of any charges. But her mom says her previous pregnancies went off without a hitch.
She had 3 children that were healthy. The All her pregnancies were good. They were, no complications. They were full term.
De La Rosa says Sabrina was excited for her baby boy because she was going to complete her family.
She was really thrilled. She didn't think she was going to have any more. And my mom had just passed away 10 months before Sabrina did. Sorry.
Now the rest of their family is working to move forward, but she says it's not easy.
Traumatizing for not just me, her mother, her siblings, which she has 2 sisters and a brother, and but to her other children. She has a 16-year-old daughter who was, at that time 13. And her other daughter and her son and the baby that she'll never meet.
While her memory lives on through her 4 children, most of them are in therapy as they continue to struggle with the loss of their mother.
My grandchildren are scared to go to the doctor. They're afraid to walk into a hospital. It's just, how do you deal with that? How do you go on? How do you make it okay for them when their mom went in healthy and never came out walking? She came out in a body bag.
What's the response to the people who say, well, they just made a mistake, but the mistake cost your daughter's life?
I don't think that there's a mistake. It's a behavior that they've gotten comfortable with, because a mistake is, I messed up and let me fix this. If you look at the deaths here in Kern County, there is no mistakes. It is just lazy, outright just non-caring and negligent. Their mind is, these women are charts. They're not human.
While Sabrina is gone, De La Rosa says she is continuing to learn from her daughter's death.
Those that, don't know, you can ask questions. Ask before you even commit to a doctor. You can interview that doctor. You can ask them, questions, and before you commit to them. I never knew that. And
adds she just doesn't want people to experience what her family will forever go through.
If people think that it couldn't happen, it can't happen to them, please think again. I would have never thought in a million years that my daughter would die, going in to have a child. I never thought that she would. And it was preventable, so there was no need for her to die.
Again, Sabrina leaves behind her 4 children, 2 boys and 2 girls. Maternal mortality rates continue to increase across the United States. According to the Centers for Disease Control and Prevention, the maternal mortality rate in 2021 was 32.9 deaths of mothers per 100,000 live births, compared to 23.8 of mothers in 2020 and 20.1 in 2019. And the rates are even more alarming for women of color. The CDC says in 2021, the rate for non-Hispanic Black women was 69.9 deaths of women per 100,000 live births, compared to 23.8 in 2020 and 20.1 in 2019. Meanwhile, in Kern County, from 2015 to 2020, nearly 90 Black women died from maternal complications per 100,000 live births. It's with that information that we decided to discuss with a doula and an OBGYN about this alarming issue, including ways to prevent pregnancy-related deaths and how to advocate for yourself in a medical facility.
One of the biggest complaints that I hear from patients across the board, from women who have been adversely affected by the healthcare system, is the fact that they don't feel heard. And that's been an issue from the start.
Tasca Moore is a doctor who specializes in obstetrician and gynecology, but she knows sometimes patients struggle with their physician listening to them. But her advice to healthcare providers is to take the time to understand what that mother may be going through.
We have set up a healthcare system that will fail. Just by those basic groundwork, the structure of our healthcare system, we ought to prioritize the ability to be able to talk to a mom, to be able to hear what's going on with her. And for my clinicians, always ask the why.
And when it comes to women of color, statistics show they are more likely to die when giving birth. It was the high maternal mortality rate that motivated Moore to start an organization with other doctors called Healthy Bump.
Definitely a terrifying thought, being pregnant and black and thinking, I need to be able to and ready to advocate for myself.
More disparaging for women of color because our journey is a little bit different, our experiences are different, and we wanted to have that discussion from our perspective. Not only are we clinicians, but we're also patients as well. So we do have that dual experience of knowing what the healthcare system is like for women of color, and also have the professionalism to discuss the topics that are critical to us.
Healthy Bump starts with making sure women are educated when it comes to their birth.
Part of the way we address that is by informing women, because one of the things that we've noticed is the more a woman is empowered, the more she's aware of her own health and the things that she needs to be aware of, to watch for, the more empowered she is and the more control she has over her health care.
But some moms may need additional emotional and physical support during pregnancy and childbirth. For that, many turn to a doula.
When you have a childbirth educator or a doula, they give you evidence-based information from all aspects, from the hospital, from a home birth, whatnot. They're giving you evidence-based facts.
Nikki Avila is a local doula here in Bakersfield. She says her work is not only about advocating for mothers, but letting them know their rights.
Tragedies can happen because of not being informed. So when you are informed about your body autonomy and your rights over your birth, and you feel empowered.
Avila adding she sees the most success in her clients when they feel like they have people in their corner.
It's a tragedy when you don't have the support. And I see that a lot, is that people just don't feel like they deserve a doula, they can't afford a doula. We have plenty of doulas in this town. I would say there's like 25 of us doulas in town. They just need to search, look for us. We're online, we're on Google, we're on Yelp, we're everywhere.
No matter what your childbirth plan is, it's important to take time when deciding your health care.
Letting women know that you can search for your healthcare provider. You don't have to choose just who's in your neighborhood just because. You can address it with your insurance company and ask them for referrals to another provider if you don't feel comfortable.
Moore adds, once you've decided on your provider, continuing a healthy lifestyle can prevent negative outcomes when you are pregnant if you start before pregnancy.
I think that's one of the aspects in which we can improve outcomes is we know that a healthy lifestyle, healthy diet, improves fertility, and we know that there's fertility issues in the U.S. So if we improve the lifestyle of women, optimize their health, so women who have chronic diseases such as diabetes, such as hypertension are well controlled, then their outcomes are going to be better.
But Moore says it doesn't stop there. Even after pregnancy, she says it's important for patients and providers to keep their relationship.
Making sure that there's a continuity of care. This is something that ACOG is working hard to do, is to make sure it's not just, oh, you're done, you're delivered, that's the end of our story. No, that's the continuum of our story, making sure that after the delivery, that patients have a continuity health care, because her next pregnancy is also important.
She says these steps are important for learning from mistakes that have occurred in the past and taking steps towards a better future.
So when she just experienced preeclampsia, making sure that moms know now it's time to really continue taking good care of yourself, because preeclampsia increases the risk of long-term hypertension, of heart disease, and things that we can't prevent.
Moore says she believes the United States spends more time on the commercialization of Mother's Day, but there's not enough time going into taking care of moms.
Prioritize moms, prioritize the celebration of birth, bring that back. Right now, birth is just a process to us, but that's not what birth is. Birth is a miracle that ought to be celebrated. And if we change how we treat women as a whole in this country, then the symptom of that or the outcome of that will be an improvement in how we care for our moms.
But she adds it will take everyone coming together to make a difference for mothers.
This is going to take a team effort. The healthcare system is such a myriad of different aspects of it that there is no one solution to this maternal health crisis. This is all hands on deck.
For more testimonials and lessons from women of color healthcare providers about pregnancy planning and journeys, you can visit the Healthy Bump Club Instagram or YouTube page. Welcome back. In 2021, Larsenia's Taylor life changed when she lost her husband, James Taylor. She says he fainted at their home in Southeast Bakersfield and she called the ambulance. And this wasn't her first time having to call the ambulance for her husband, but she didn't know it was going to be his last ride.
I can't take it off.
More than 2 years later, Larsenia Taylor still wears her wedding ring after being with her husband, James Taylor, for 45 years.
James was loving and kind. Everybody that talked said he was such a kind person. And where you saw me, you saw him and the kids, because we did everything together.
As she shows me photos of her husband, Taylor says to know James was to love James, and that has never changed for her since the 1970s.
And then from there, we got married in March of '78.
And we're together ever since. But April 16th, 2021, when James was 65 years old, that changed.
My husband was taken to one of the emergency rooms here in town. He had fell out. He had passed out in the front yard. So I called the ambulance.
Taylor says James was taken to the hospital, but she wasn't allowed to go at the time due to COVID. But when she called back later to check on him,
they said code blue in the emergency room about at least 6 times. Code blue. And I asked the person that answered the phone, I said, I hope that's not my husband.
After her phone call, she says she went to the hospital to see what was going on.
When I got there, I was met by the chaplain and a few nurses, and they told me my husband was dead.
Taylor says the doctor told her that her husband just stopped breathing.
When he left our home, he was cognitive. He was talking, he knew where he was, and according to the medical records, he was cognitive in the hospital.
But for her, she says she couldn't wrap her head around her husband just dying suddenly, so she requested his medical records.
After I got the records, there were a lot of discrepancies to me. For example, they had introduced a new medication to my husband.
Taylor says that new medication was Zofran.
I looked it up, and it specifically said, do not give to an individual who has heart trouble.
But she says James had a history of heart complications, including a prior heart attack, prior cardiac stenting, and a defibrillator.
You can give Zofran to individuals whose heart is strong. Well, James' heart was weak. So according to their record, their own records, they gave him 4 milligrams of Zofran with the IV.
A search for Zofran on the FDA website says to avoid Zofran in patients with congestive heart failure. After learning this information, Taylor says she took the complaint to the California Department of Public Health.
They came back with a report saying that my concerns were substantiated with the complaint.
Documents from the California Department of Public Facility failed to follow policies and procedures on NA 151 standards of care, assessment and reassessment and medication reconciliation process when home medications assessment were not reviewed or documented for one of the 3 sampled patients. This failure had the potential to adversely affect patient 1's plan of care and treatment. But this doesn't change the fact her family, including her 2 children, are left heartbroken.
We were destroyed, really, because, you know, he did everything, we did everything together. We went to church together, Disneyland together. We did everything together.
When it comes to the case of her husband and her family suing the medical facility for medical malpractice, Taylor says though she has not lost faith in every doctor, it's important to understand that things do happen.
I don't think in a negative mode. You know, you give doctors you're confident that they know what they're doing. To this day, I still think doctors know what they're doing. But we have to understand, just as any other profession, there are bad ones. There's bad teachers, there's bad professors, That's just the way it is, and doctors are not immune from not knowing their job or being negligent.
Her advice to others:
number one, be with your loved one in the ER. Number two, make sure that they don't introduce a new medication to your loved one that you're not aware of. And number three, if the doctor seems to have a issue with you, document that and take it to the people that are in charge in the hospital.
Because now their family's life will never be the same.
My husband will never be back. He'll never be here with us again. Just because of something that someone or a corporation did.
Her heart's still yearning for James 2 years later.
He is so missed. I can't describe it.
A 10-day jury trial is set for March 11th, 2024 at 9 a.m. Crystal Guijarro is a mother of 2 young girls. She tells me, as a mother, you know when something is wrong with your child, which is why she was so frustrated when her youngest daughter was sick and doctors kept sending them home. And when her daughter was finally diagnosed, she says something that could have taken a few days in a hospital turned into 4 months.
I was lost because I was like, well, like my child was helpless, she's helpless, and like, what can I do? I see my daughter there, I think she's gonna die, no one's coming to tell me anything.
On December 30th, 2021, Crystal Guijarro took her 3-year-old daughter Layla to a local hospital.
I told them her symptoms. She just started with some mild symptoms like a fever, and then she started throwing up and not wanting to eat. So I took her and they told me, they just examined her and they told me, it's just a virus, norovirus. That's the diagnosis they gave me.
But she says days passed, and after attempting to treat Layla for the virus, she got worse.
My daughter was no longer walking. She was in aching pain. She was not eating or drinking anymore. High fever, very pale. At this point, I was like, this is not a virus.
Then, Guijarro took her daughter to a different emergency room in town.
I went in, and little did I know that my nightmare started that day.
Once the hospital ran tests, they gave her a different diagnosis.
After 12 hours, a doctor comes in, and he tells me, there's nothing wrong with her, Mom. I'm like, what do you mean? Look at her. She's not getting up. She has high fever. And this doctor, he tells me, it's just constipation.
Guijarro says she and her husband were still not sure constipation was the only thing wrong with their daughter. So she says they questioned the doctor.
I told him, are you sure it's not her appendix? And he was like, no. He's like, I'm telling you, it's constipation. He's like, nowhere it shows it's her appendix. So he dismissed that right away.
Then once again, the family went home, this time treating Layla for constipation.
This time we noticed her stomach was already distended. It was very bad. We got concerned. I took her a shower and I was like, she needs a suppository. So I did the suppository. But we noticed it wasn't that. We noticed there was something more. She started vomiting.
Again, on January 5th, Guijarro took Layla back to the first hospital, where she says she was finally able to get answers about what was going on.
She confirmed that it was ruptured appendicitis.
But she couldn't be treated there. She says the doctors told her they had to wait until there was an ambulance available because they were short-staffed.
It wasn't until the next day that there was an available ambulance in the morning. At that time, it was like a 4-hour drive for us.
When they finally arrived at the Children's Hospital, she says their problems were far from solved.
Because of this doctor's mistakes, Layla had a rough 4 months in the hospital because she had a lot more complications.
Guijarro says it first started when it took longer to remove Layla's appendix.
They couldn't remove the appendix right away. They said it was too dangerous, that they don't do that. They have to first use antibiotics and get it controlled, and then later go back. Once she stabilized, go back to do the surgery.
Guijarro telling me this time in the hospital later led to doctors saying her daughter had COVID, multi-system inflammatory syndrome, also known as MIS-C, and sepsis.
She had the bile in her stomach. So she had tubes through her mouth, through her nose, the PICC line, they had to put a PICC line, and the drainage.
Since Layla had to be treated away from Bakersfield, Guijarro says that put an extra strain on family finances.
He had nowhere to sleep. We would sleep sometimes in the car, like when he would go visit, because he had to go back to work because bills don't wait. And that's what I noticed, that sitting in a hospital bed, besides going through what you're going through, you have a life that doesn't wait. Your bills don't wait. Your jobs don't wait.
Adding she wasn't able to work during that time, so her husband was the only source of income. Outside of finances,
I had to deal with my child, thinking that I didn't love her because of everything they did to her.
The effects of being in the hospital are still felt by Layla now, nearly a year and a half later.
She's traumatized from it. The first nights when we were finally home after surgery, she would cry, wake up at nighttime.
While it's still an uphill battle for their family, Guijarro knows they are lucky.
Fortunately, not a lot of people get the opportunity to live from one mistake like this.
Layla is turning 5 soon, and as for her health, she's doing much better.
She's healed now. She's running. She's playing soccer with her sister. Her sister's in track, so she goes and cheers her sister, like, go Delilah, go. And it's good. It feels good. It honestly does.
Guijarro now wants to encourage all parents to advocate for their children, because Guijarro says if she were not insistent, the outcome would have been very different.
My child's life was in his hands, and my child almost lost her life due to this careless doctor. Imagine if I would have waited, like the doctor told me. She's like, Mama, you did a good choice by bringing her in. She's like, you would have waited one more day, you will not have your child here.
Guijarro says they have reached out to the California Department of Public Health but have not taken any legal action yet. They're just focusing on making sure both of their daughters stay healthy. Here's another resource you can use to explore different perspectives for your healthcare facility. Behind me is a website called Leapfrog Hospital Safety Grade. All you have to do is type in your area like Bakersfield, and then the grades will come up for all of the local hospitals. As you can see, we put in Bakersfield, Mercy Hospital Downtown comes up, Adventist Health Bakersfield, Bakersfield Memorial Hospital, and more. You can also click on view the full score, and once you click on it, you'll get a full breakdown of some of the categories. You can see infections, problems with surgery, safety problems, and more. You can also scroll down and get even more of the breakdown and the hospital specific score. As you can see, we did click on Adventist Health and we get all of their breakdowns. You can also search past safety grades as well. When you click this, you can see all of their past scores, and Adventist Health is one of the only 20 hospitals in the country to be awarded an A in every hospital safety grade cycle since 2012. I sat down with their medical officer to discuss how patient safety is not easy, but they do their best to make it their top priority.
We know that we are human and things can happen, mistakes happen, but our job is to get together and try to learn from these mistakes.
Medical officer for Adventist Health Kern County, Dr. Cassandra Maladine, has been in healthcare for nearly 40 years now and says the industry is not easy to navigate.
Healthcare is really is complicated.
Jamaluddin says sometimes they only have minutes to determine what actions to take when someone comes into the hospital.
The patient comes, many times we have just the symptoms and then we have to act on some information in a very short period of time, especially if the life of the patient is at risk.
And while he says mistakes can happen, he says it's important to learn from them.
Very important to be learning organization and learn from errors that haven't led to harm for the patient and learn how we can prevent them.
Jamaluddin adding it was more than 20 years ago that patient safety changes started being addressed.
It was addressed from the aspect that we are human taking care of human, and human can err, they can make errors. So how can you address these errors and how can you design a system that will make the likelihood of these errors to happen much, much less?
At Adventist, one of the first things doctors do is make each other aware of each medical case or procedure before addressing it.
Having staff who are skilled, but also who have emotional safety to speak up if they see something that is not feeling right about the care of the patients or the care environment.
When it comes to safety problems, Adventist Health Leapfrog score is 0.69 compared to the best hospital score of 0.5, an average hospital score of 0.98, and the worst hospital score of 2.70. For effective leadership to prevent errors on Leapfrog, Adventist score is 120, with the best hospital score also at 120, the average hospital score at 116.96, and the worst hospital score of 9.23. Jamaluddin credits the consistent score to day in and day out focus on patient safety.
We do huddle to ask people to escalate. We welcome escalation when there is something that is putting our patients at risk. We discuss cases, we learn from each other, and that's how we got there.
And he adds learning isn't just for the patients, but for them as well.
Taking care of patient, puts a physical burden on us. So being cognizant about this and trying to continue to learn is extremely important.
Another factor to taking care of patients, according to Jamaluddin, is listening.
Healthcare, what has happened over the years, the regulatory requirement, or what we call the red tape and the authorization and the paperwork, has put the barriers between us and the patient. And it's very important to realize that those barriers should not stand between us and our patient.
He says understanding what patients need and how to effectively communicate with them is key to creating a safe environment.
Listening has become more critical and more demanding. So it is important really to address this issue, and it is really also in the heart of patient safety. Once we stop listening to our patients, we are going to lose the game.
Lastly, there are people who have taken the time to help families navigate situations when it comes to health care. I sat down with patient safety advocate Michelle Monsat Ramos. She's worked with families here in Bakersfield to educate them on the resources they can utilize to learn more about their health care providers. She also started doing this work because of her own personal experience. I'm joined with Michelle. She's a consumer advocate, and you've worked on a lot of these cases with a lot of families here in Bakersfield and Kern County when it comes to medical negligence. First, tell me how you kind of got involved in this work.
Well, actually, I became a patient advocate because of my own tragic loss. I lost my husband to be 3 days following elective surgery, and I was like every single one of the Kern County families that I work with today. Something that shouldn't have happened, completely unexpected, and you don't know what to do. So I went through a process. I investigated his death because I was given no cause. I went through the medical board process, everything all the families here are doing. And so having gone through that process, I became a state and national advocate, where I work with advocates across the state, across the country, on various issues. And from then I transitioned into legislation. I worked on changing some policies with the medical board and was able to get through legislation for a number of things, including the Patients' Right to Know Act. So I did all of these things, and now I work with Consumer Watchdog, and I work with families across the state of California to help them navigate through this entire process from the moment. Sometimes they have a family member that's still in the hospital, and there's still time to help them. And there's been a local Bakersfield family that I've worked with through that process. Other times there's other families that they've faced a tragedy and they don't know what to do. And because I've gone through the entire process, I've hit every wall, I know everything that can go wrong. I'm able to help them navigate through the entire system. But it's based on my own personal loss.
Well, thank you for, turning your tragedy into triumph and helping others, obviously. And you've worked with, like you said, a lot of families across the country, across the state, but also families here in Bakersfield and Kern County. In your work, and a lot of families I spoke with, and even the numbers that I've seen on, the California Department of Public Health website, have you seen more medical negligence here in Kern County in your work?
Yes, it was actually shocking how much more medical negligence, how much more harm I saw here in Kern County than anywhere else in the state. And, you know, the first family that I actually reached out to, and I helped them. And then there was an article that came out and some press coverage, and a number of families started reaching out, and it was almost like a domino effect. It was shocking how many people reached out. And there was nowhere else in the state where that many people in one community, you know, and many that were harmed by the same physician. So I knew once I had an entire group of people that needed help, I knew that I needed to spend some time and focus my efforts here in Kern County.
If people feel like something is wrong, what is the first thing that they should do, and how early can they do it? I mean, you talked about pregnant mothers, right? Like when should they, you know, say something, and how can they say something, and what can they do?
Well, initially, when it comes to pregnancy, when it comes to chronic diseases like cancer, dialysis, you really need to take an advocate with you. You know, when you're sick, when you're hospitalized, you're in more of a vulnerable state, and you're not going to catch everything. There's some questions you may forget because you're just not feeling well, and many times you're afraid. And so you really need, if at all possible, you need to bring an advocate with you. The person that is going to help you ask questions, the person that is going to ask for a copy of your labs. As many times the healthcare professional will come to your bedside and said, you know, labs are taken first thing in the morning, and they're like, oh, your labs are fine, you're doing okay, we'll do this. But many times, if you don't see that copy of those labs, there are some numbers that are off. You know, things that long-term wise you can work on, and many times you don't know until it's too late, and you end up with, you know, a complication that's become an issue. You end up with a chronic disease. And so those are some of the things that you can do for yourself early on. Another thing that you can do is look at the background of your physician. Look into the hospital. You know, your local hospital, a lot of people are part of a healthcare group, so they're assigned a hospital in most cases.
You can also interview your doctor, right? And so what kind of comes with that? You know, can you interview them even when you just go to the ER? Like what does that look like? Obviously you can interview them too when you're picking like an OBGYN. Talk about that interview process that people can do with their doctor.
You can. You know, you should ask questions. It's important. You know, when we think about the things that we do when we buy a new cell phone or a new piece of electronic equipment, we do our research, right? You know, we want the best quality of phone, you know, but for some reason, most of us don't do that when you know, we need a pediatrician for our children, or, you know, someone in our family has become pregnant and needs an OBGYN. We don't do our research, you know, so you're right. You can go in on your first appointment and you can ask questions, and you should. You know, you should want to know, you know, how long your physician, you know, what his specialty is and what his focus is in. And, you know, you can ask about judgments and other things, and it's up to the physician, you know, to reveal it to you or not. So, you know, many cases, you know, if there is a problematic record, you may not find out that way. So you use these other tools like Cal Find Health and the Medical Board website. And like I mentioned, there's some things that are not available on the Medical Board website. So then what you want to do is go to your local online, to your local Superior Court, and run a search, a civil index and a criminal index search on your physician's name. And in the civil index search, you'll find out other people that may have tried to sue your physician and for why. And that will give you more information as well.
Thank you so much, Michelle, for taking the time to, you know, share all the resources and all the tools that you have in your toolbook. Thank you. Thank you again. We hope this special Do No Harm, Loss and Liability in the Medical Field helped you, the community, remember the importance of asking questions as a patient, not just from your doctor, but all medical facilities and providers. Again, all of the resources we spoke about and all of the individual stories we told can all be found on our website, turn23.com. For this special edition, I'm Brianna Willis. Have a great night.